Welcome to the Movewell Academy and our Palpation Series. Let's start with the bony palpation on the medial aspect of the foot and ankle. The easiest place to start is the most prominent bony landmark, which is the medial malleolus. Let me show you first on this bony skeleton. So if you follow a methodical way to palpate, you can find a lot of really important things to palpate that may pertain to orthopedic injury. So from the distal medial malleolus, if you drop down about a half inch, you will feel this tiny bony prominence, or if you approach it from the bottom of the arch, you will feel this bony prominence, and this is called the sustentaculum tali. This is the shelf on the calcaneus that the talus sits on. It's important to be able to palpate it because in rapid inversion injuries of the foot and ankle, someone may sustain a fracture at the sustentaculum tali. From that point, if you move towards the toes, the next major bump you feel is the tuberosity of the navicular. This is the major tarsal bone on the medial side of the foot. As you move distally yet, you will feel the first cuneiform, which then articulates with the first metatarsal. And then you go down to the first MTP joint and then the IP joint of the toe. Right? This first MTP joint is important because it is usually the joint that is involved in hallux valgus or bunions. Right? So let's do it on a real foot here, starting with the medial malleolus. If you drop down a half inch and then approach from the bottom, you will feel a tiny bump that is the sustentaculum tali, the shelf on the calcaneus that supports the talus above it. Then you move towards the toes, you'll feel a big bump here. This is the tuberosity of the navicular. Fall off that bone, and now you are on the first cuneiform. Continue past first cuneiform, and now you are on the first metatarsal, which forms the base of that first MTP joint, the joint that is important in bunions or hallux valgus. It's involved in it, right? Now, it's really interesting to note you should be able to get about 45 degrees or more of passive and active toe extension. Here, that would be the normal amount of extension you need to get walking and running without excessive pain. People who lack toe extension will tend to supinate the foot, and that creates all sorts of problems. So that's the bony palpation on the medial side of the foot and ankle. What about the ligaments? There are three major portions of the deltoid ligament that are on this medial side. They, of course, check eversion of the ankle, but you can visualize them like a fan. So running in the anterior direction here, this is the anterior deltoid ligament. Coming off the tip would be the mid-deltoid ligament, and then posteriorly would be the posterior deltoid ligament. And you can palpate it by running your finger perpendicular to each ligament to determine if it is tender and potentially torn. You can also test the ligament by placing each one of them on a stretch. They all check eversion. So to check the anterior deltoid, you want to plantar flex and evert the ankle. To test the middle deltoid, you want to evert the ankle in neutral. And then to test the posterior deltoid, you want to dorsiflex and evert the ankle, and that will place stress on the posterior deltoid ligament. Right? So those are the three major ligaments you want to consider on the medial foot and ankle. Now let's go to the major tendons you want to identify. The first one, and the one that's most intimate to the medial malleolus, is tibialis posterior. Remember, Tom, Dick, and Harry. So in that order from the medial malleolus is how you will palpate those tendons. Tom, posterior tibialis, is the most intimate to the posterior aspect of the medial malleolus. Flexor digitorum longus will be the next tendon you feel. Then there's a tibial artery and nerve, and then flexor hallucis longus. Tom, Dick, and Harry. The most commonly involved tendon is the tibialis posterior, and probably because of its proximity to the medial malleolus. There's a chance of greater compression. You can test each one of those muscles on the medial side by doing a simple manual muscle test. Remember, you can tell that tendons and muscles are involved if pain is reproduced with stretching, manual muscle testing, or palpation. So if you're here and you can think to yourself, well, my finger can cover about 2 or 3 tendons. That is true. How do we differentiate if there's pain here, which one of those muscles is involved? You simply do a manual muscle test for each one of them. Posterior tibialis tendon does inversion of the ankle. So I will test that by inverting the ankle and saying, don't let me pull out. Don't let me pull out. 1, 2, 3, 4, 5, and see if that creates pain. Flexor digitorum, I will resist toe flexion. So curl your toes and don't let me push. 1, 2, 3, 4, 5. And then flexor hallucis longus, I resist great toe flexion. Don't let me push. 1, 2, 3, 4, 5. Okay, so that covers the tendons, the ligaments, and the bones on the medial aspect of the ankle. If you like this video, please share it, and don't forget to subscribe to our YouTube channel. Also, subscribe to our blog at movewellacademy.com, where we constantly upload and update information about pain-free living. Thanks, and we'll see you next time.